Something I fully intend to do with my company of Summit Health Co. is not only partnering with other providers, so MDs, DOs, NPs, PAs, physical therapists, nutritionists, pharmacists, but I also really want to partner with and utilize the experience and wealth of knowledge of nurses. Nurses have so much experience. They have such a fine-tuned skill set depending on which aspects of healthcare they've worked in. And I know so many nurses who actually have a great tenacity for a business mindset, for a wealth mindset, but because corporate healthcare assigns them a position and a very specific role to play, they don't actually get to spread their wings a lot. And that is something that I really want to change going forward in promoting my style of functional medicine, holistic medicine, an IV clinic, cryotherapy, IV therapy, peptides, hormone replacement therapy, a med spa. I want nurses to be in all of that and running the freaking show. Nurses have an incredible capacity to assess a situation, assess a patient profile, and understand where a patient is at, where they're coming from, where their health disparities are at, be able to tune into their health goals and come up with a plan to help them move forward. I also know so many nurses who have an incredible business mindset and an affinity to be able to drive results and be very focused on conservative measures that will protect the financial health of a client, and also that will never skimp them or that won't cut corners. You know, they're very results driven. They want the best outcome for patients and clients and employers when they are valued. When you treat a nurse as valuable, the return on that investment is incredible. One of my main components of the vision of Summit Health Company is partnering with nurses to be able to be autonomous. Obviously, there has to be a provider role fulfilled, which is what I plan on fulfilling. But as far as allowing a nurse to establish a clientele and really run the show in an IV lounge, an IV clinic, that is totally different than the provider being in charge of everything and trying to minimize as much as possible all of the costs of employing someone like a medical assistant, which is fine and plentiful, but I want to employ nurses. I want to partner and contract with them in a way that they're able to run the supplement shop. They're able to run the cold plunge spa and cryotherapy. They're able to do the bariatric therapy, the zero gravity therapy, and allow them to really integrate into this business model for a partnership of nurses coming together and other intermediaries within healthcare that maybe are burnt out or don't see themselves functioning well within the corporate healthcare model. Because the corporate healthcare model fails a lot of patients, it fails a lot of practitioners, and it fails a lot of nurses. And this is another caveat. Summit Health Company is another caveat. It's an opportunity to partner as healthcare practitioners and nurses to bring abundance and health and wellness to a larger community. Right now, I know it is a lot of theoretical talk and it's not hard and fast, but as this grows, I can't wait for people to become a part of it. I can't wait for my brothers and sisters in the nursing industry to capture the vision. That is the whole reason that I went back to nurse practitioner school to get a provider's license, is so that I can be the medical director and allow a partnership with so many other nurses to run their own show with me being the overseeing physician, but them being autonomous, valued, and like seen for the whole contributor and wealth of knowledge that they are. So there's so much more to come. This is something I'm very passionate about, and I can't wait to see how this all comes to fruition and the way that I am able to change and allow nurses to change their own lives, their financial wellness, their health and wellness, their mental health, and just the way that they're seen and valued. That is what I want.